My name is Nick Monreal. I'm the Managing Ombudsman for the Bay Area Agency on Aging Ombudsman Program. Recently, we shared with you questions to ask in selecting a nursing home. We have a number of questions that when selecting an assisted living facility, which is a facility that does not provide full-time skilled care. However, there are requirements to assisted living. Residents need to be ambulatory, which means that they are able to exit a facility in case of a fire. There are a number of types of facilities, and we will make available a chart on the description of those types of facilities. What is most important is that in inspecting any type of facility, that whether it's small or large, and assisted living facilities do come in different type of sizes and cater to a number of type of residents, that you are sure to seek out a copy of the license. It should be posted on the wall. There are a lot of issues with unlicensed facilities throughout Texas, and it's important that if you're going to put your loved one in an assisted living facility, that the facility is a licensed facility under licensure regulations with the Department of Aging and Disability Services of the state of Texas. There are 4 types of assisted living facilities, A, B, and C, and we will discuss these types at a later date. However, what I can say is that each of these facilities is determined by the level of care that is required and the number of residents that are able to be in these facilities. Do they have their most recent survey? You need to find out if all facilities, nursing home or assisted living, need to post their more recent survey from the Department of Aging and Disability Services for public review. Who oversees the facility? Is there a manager, an administrator, a director? You need to know who is the person responsible for the oversight of staff and residents in assisted living facility. Unlike a nursing home, assisted living facilities are not as structured staff-wise. Therefore, you need to be sure that you know who is in charge of supervision. Do they maintain a trust fund for residents? This is important for you to know as far as expenditures and personal items that need to be purchased by the residents. In many cases, a lot of residents that are in assisted living facilities have dementia or Alzheimer's. It's important to find out if the facility is certified to meet these type of needs and care levels. Number of nurses in the facility, who is responsible for the patients, and how many beds are available in the facility. In looking at assisted living facility, and you want more of a one-to-one care, it's important to know that the facility is not going to be overwhelmed, and the staff is able to provide a closer one-to-one care for your loved one. Has the manager of the facility completed the required assisted living education and training courses to manage the facility? You want to know that that individual is certified and capable of doing the activities, overseeing the activities of the facility. Our full-time facility attendants age 18, at least 18 years or older. Many assisted living facilities, especially your smaller ones, have a lot of youth that have been trained in local programs. However, even though because of age, they are certified and they are trained. But you need to know who these individuals are. Has the facility developed and implemented the required staffing policies and staffing pattern posted on a monthly basis? You want to know how many staff they have available and when and what time and schedules that they have. Does the facility have enough staff to maintain order, safety, cleanliness, assist with medication regimens, prepare service meals, assist with laundry, and ensure safe evacuation of the facility in case of an emergency? This is self-explanatory. This goes towards the overall level of care for your loved one and safety of your loved one. Does the facility employ licensed nurses, certified nurses aides, or certified medication aides? There again, this goes towards the quality and level of staffing of the facility. Does the staff have communication techniques and skills in improving geriatric care, assessment, nursing, interventions related to common physical and psychological changes of aging in each of the residents in the facility in the event that there are particular levels of care? Many residents that are in assisted living are borderline nursing home classification residents. Therefore, it is important to know that they're in an appropriate arena and atmosphere. Is the staff educated in the area of geriatric pharmacology, including treatment, pain management, food, drug interactions, sleep disorders, including common mental disorders? This goes towards the level and quality of care for your residents. It's important that all of these things be looked at because assisted living facilities are regulated by the Department of Aging and Disability Services. However, the licensing standards for assisted living facilities are not as critical as they are for nursing homes. So therefore, if you're looking at an assisted living facility, please make sure that it's licensed and that it is appropriate for the level of care or medical necessity of your loved one.